Indiana's News Center continues with the Noon Extra on 21 Alive.
And welcome to the Noon Extra. We're taking your calls about the daily topic. The number to call, 483-8331. And here today is attorney Dave Farnbaugh, one of our regulars. It's good to see you.
Corinne, it's good to be back.
Now, we were just talking in the break. This is pretty timely with the House passing healthcare reform legislation last night. You said that there are some things from a legal perspective that maybe don't add up.
Right, Corinne, I think what I wanted to share with our viewers about the vote that just came down on the health care plan is, as our viewers may or may not know, there was no significant tort reform measures that were included in the health care package that was just filed. That was one of the things that I think was subject to debate, whether there was going to be some tort reform like capping damages in medical malpractice suits.
And tort reform means revising the law?
Mostly what it means in the context of health care, Corinne, is capping damages on medical malpractice suits.
Okay.
One of the theories with trying to reduce health care costs was that if you put caps on medical malpractice suits, that would result in lowering of health care costs, that doctors practice too much defensive medicine. They order unnecessary tests because they're afraid they're being sued, that there's runaway jury verdicts in medical malpractice suits, that if you cap damages, you'll bring down the cost. And one of the things I think our viewers ought to know in this debate are some of the facts regarding what costs are associated with the medical malpractice system that might contribute to the health care system.
Such as?
One of the things I think the viewers ought to know, Corinne, is that if you completely eliminated all medical malpractice lawsuits altogether, if there were no malpractice awards, if doctors weren't charged premiums for medical malpractice, the total cost to the healthcare system would be less than 1% of the total healthcare costs.
Oh, so it doesn't have that much of an impact.
Right. So if you completely, like I said, if you completely eliminated medical malpractice from our healthcare system, it would only eliminate less than 1% of the total costs.
Okay.
About $1 in every $6 in our economy right now is spent on healthcare. So the Congressional Budget Office said that if you put a cap on damages, you could reduce healthcare costs by about $11 billion a year. But people have to have that perspective that $11 billion a year would be less than 1% of the total cost of health care.
Wow. Okay, so something that perhaps the congressional leaders didn't take into account or didn't think through, perhaps?
Well, they might have taken into consideration, but my point is that if you just eliminated that whole system altogether, you're really not going to eliminate health care costs or significantly reduce them for consumers.
So, sounds good in a soundbite.
Right.
Okay. Well, listen, we are taking your calls about legal issues. So give us a ring, 483-8331, and we'll take the first caller when we come back.